Alright guys, in case you were wondering how to treat a person who's suffering from hypoglycemia, in other words, whose blood sugar is very low, in this video I'm going to explain to you how to do so on an advanced life support level. From the basic, in this video I'm going to explain to you how to do it from the basic life support level all the way up to the advanced life support level. So if you arrive on scene and you have a person whose altered mental status, the family members tell you that the person's not acting like themselves, or you see the person by themselves acting kind of strangely, acting as if they were drunk, you take their blood sugar with the finger prick, right? If you take the blood sugar and it's below 60 for any patient, that's low. And if it's between 60 to 80 for a diabetic patient, that's still low. That's still to be considered low. In other words, if you get a blood glucose level of 79 in a regular person, then that's all right. But if you get it on a diabetic patient, that may still be low. So if the person's able to swallow, then you start off with this, which is a glucose paste that you give in their mouth, and eventually it'll dissolve, get into the bloodstream, and help raise up their sugar. If that doesn't work, then you start an IV. And a lot of times diabetic patients suffer from renal failure and their vasculature might not be the best, so don't be shy to use the 22 gauge. You start the IV. After you start the IV, you give them dextrose via the IV. Make sure you flush it afterwards. If you don't have IV access because it was too difficult or the patient was not cooperating, you always have the option to give the glucagon, 1 milligram of glucagon. This is sterile water, that's glucagon. What you do is you draw up the sterile water from here, inject it in there, shake it up, then draw this out and use the muscle that you want to choose. You could choose the deltoid muscle, it's one of the options. Use the alcohol, use the needle, inject them with that. All right? And if the cause of altered mental status has to do with a narcotic usage or suspected narcotic usage, those you could get, or those you could suspect when the person has track marks on their arms, when they have pinpoint pupils, when they have a history of substance abuse, specifically IV drug abuse, and when they have hypoventilations. And the antidote for that will be naloxone, which is, in other words, Narcan. So that's the treatment for that. You can give this medication also. So you arrive on scene, you have the option to use this as a basic life support provider. A lot of times people at home have their own glucagon. That's the way they're supposed to administer it. The saline inside of the glucagon, mix it up and draw it out on the needle, and then inject it in the muscle. For paramedics and advanced life support providers, start an IV. Don't be scared to use the 22 gauge. Give the D50. And if that doesn't work, call your online medical control and ask them if you could give something else, or ask them for guidance. And if there's a suspected overdose of opiate, then give the Narcan. Alright guys, I hope this helps. This is how to treat a person who's in altered mental status due to hypoglycemia or opiate overdose. Just remember, there's other causes of altered mental status. I hope this helps. Please share with someone